The Zambian government, under the able leadership of His Excellency, the President Dr. Edgar Chagwa, in collaboration with our numerous partners across sectors, has worked tirelessly to mount an effective response despite the numerous challenges that we have faced along the way. We commend our diligent healthcare workers who have made it possible for us to continue delivering routine health services while managing the increased demands on the healthcare system that come with such a prolonged response to COVID-19 pandemic. The resilience exhibited by our staff and indeed the health system at large is testament to the fact that our challenges are not insurmountable. As we take stock of these challenges, it is also important to remind ourselves of the numerous positive gains we have made as a country in these difficult and challenging circumstances, and also to document the many lessons learned and best practices. As we look across the SADC region, the Southern African Development Cooperation region, it is encouraging to note that Zambia is among the countries recording significant gains in laboratory testing and patient outcomes, both in terms of recoveries and also in terms of mortalities. Similarly, we have scored lower numbers in terms of the number of recorded cases per million population. As we observe lengthened stay among patients in our intensive care units, it has become imperative that we further extend our clinical care capacity. The Ministry of Health is scheduled to commission the new TB multi-drug resistant wing at Kiko Teaching Hospital in the coming days, which in the meantime will serve as the COVID-19 case management center, since Kito Teaching Hospital has space constraints and serving a huge population. Further, we have deployed critical care and infectious disease specialists to Copperbelt, Muchinga, and northwestern provinces to strengthen the COVID-19 response. We are also encouraged by the tremendous show of support from a wide section of society, both within Zambia and outside Zambia, following our announcement regarding the establishment of an oxygen plant on the Copperbelt. We are working on finalizing the projections and implementation plans for the project in order to effectively leverage our resource mobilization from various quarters. We are also appreciative of the support from the United States government through USAID towards covering remuneration for critical care nurses for a period of 3 months. In addition, government has also made strides to employ additional nurses and other healthcare workers through the Public Service Management Division. The Ministry of Health wishes to acknowledge the generous support of the MTN Group towards the African Union's COVID-19 vaccine acquisition and deployment efforts through a donation of $25 million. Additionally, MTN has at country level donated personal protective equipment towards the COVID-19 response and participated in the disinfection of our public spaces, including bus stations such as Kurima Tower. I also wish to inform the nation that the Ministry of Health held a successful engagement meeting yesterday with the Electoral Commission of Zambia to chart the way forward in preparations for the campaigns and elections slated for later this year. The meeting resolved to explore a number of avenues and innovations to ensure safety for Zambian citizens before, during, and after elections. The Ministry of Health will support the Electoral Commission of Zambia at national and sub-national levels as ECZ carries out its constitutional mandate to conduct elections in a safe manner. Fellow countrymen and women, the COVID-19 situation update for the last 24 hours is as follows. We recorded 555 new cases out of the 3,910 tests conducted. That's a positivity rate of 14%. The cases were reported from the following provinces: 178 Lusaka, 136 Northwestern, 118 Northern, 47 Eastern, 30 Southern, 22 Luapula, 12 Copperbelt, 9 Western, and 3 Central. This brings the cumulative number of confirmed cases recorded to date to 75,582. And I also further wish to inform the nation that we last week got in 600,000 rapid diagnostic test kits, and we urge all the provinces that have not collected these test kits from Lusaka to do so immediately. Sadly, we recorded 9 deaths from the following provinces: Copperbelt 3, Northwestern 3, Luapula 1, Lusaka 1, and Western 1. The cumulative number of COVID-19 related deaths recorded to date now stands at 1,040. The deaths are classified as 564 COVID deaths and 476 COVID-19 associated deaths. We also report an additional 508 discharges from both COVID-19 isolation facilities and home management, bringing the cumulative number of recoveries to 69,436, or 92%. We currently have 5,106 active cases. Among the active cases, 4,789, or 94%, are under community management, whereas 317, or 6%, are admitted to our COVID-19 isolation facilities. Of those admitted, 209 are on oxygen therapy and 41 are in critical condition. And I should mention that generally we've seen a huge decline in the number of patients admitted to our facilities, but to mention that those who are admitted, we still have critical EU patients who require oxygen. Countrymen and women, we remain committed to enhancing behavior change through our simple yet effective 5 golden rules that we keep on announcing every day. All people know about these rules, but the challenge has been on behavior change, how to make sure that these become part of our new lifestyle under the new normal. Remember, 1, to mask up correctly and consistently. It means that you wear a face mask every time in a correct manner. Today I was visiting some health facilities in Lusaka, specifically Chawama Hospital, where even patients who come for care, some of them had no masks, others were wearing them on their chins within a health facility, which poses a huge risk to themselves and to other patients. And therefore, all heads of health institutions are directed that every patient who enters the facility should have a face mask. Otherwise, we are posing dangers to those patients. Number 2, maintain physical distance. We don't want people crowding, whether in a health facility, in a public place, in a shopping mall. These rules have to be maintained. Number 3, wash your hands frequently with soap and water or use hand sanitizer. 4, avoid crowded places if possible, particularly super spreader events where a lot of people gather at the same time. If you can help it, you're better off staying at home. And 5, seek medical attention early if you are symptomatic. Like we've said, testing for COVID, we don't want any Zambian to have a positive COVID test, but just in case you have one, it's not a death sentence. You need to seek medical attention early if you have symptoms. In addition, government also encourages the safe use of local remedies like steaming, ukufutikila, and other dietary supplements that do not cause harm. I wish you all good health, stay safe, God bless you all, and God bless Zambia. Thank you so much.
Thank you so much, Honorable Minister. In the last 24 hours, 555 new cases have been recorded out of 3,910 tests that were conducted, and the country also recorded 9 deaths. At this point, I would ask colleagues from the media if you have any questions or any clarification. Yes, please, I may come through.
Good afternoon, Honorable. My name is Victoria here from Diamond TV. Honorable Minister, in your previous statement, I think you had updated us on how far you have gone with the CAB memo, and you finalized and it was submitted. Why isn't Cabinet tabling the matter? Are you encouraged by the fact that we have seen a reduction in the cases of COVID-19 being recorded as well as the deaths? Because you mentioned that you're going to move on the super speed, but that is not being seen. I just want to confirm the statistics coming from Eastern Province, from boarding schools. We have Eastern Girls, which is said to have reported 38 cases, St. Mary's 64, Chizonia also has had an increased number to 40, including a teacher. Please confirm that. Thank you.
Thank you, Victoria. Do we have any other questions? Please walk to the mic.
Just a ride on my colleague's question. You have told us that MTN has donated about $25 million towards the acquisition and deployment of the COVID-19, but we haven't yet gotten an update on whether we are going through with it. And if the cabinet does not approve, does it mean you give back this money? And then to Professor Munga, we haven't heard on how we're doing with the post-COVID-19 clinic at UTH. Thank you.
Thank you so much, Honorable Minister.
Thank you so much for those questions. Yes, indeed, I can confirm that the cabinet memo, like we've been announcing, I think almost on a daily basis, government, the Minister of Health, together with the Minister of Finance, has already finalized and uploaded the cabinet memo. And since we uploaded, there has not been a cabinet meeting. So we are hopeful that at the next cabinet meeting, whether it's held tomorrow, on Thursday or Friday, will be guided. That will be one of the agenda items. So government of the Republic of Zambia has not changed any policy on the COVID vaccine. What we said on the COVID vaccine is that we need to reassure the Zambians that we're following all the correct steps in terms of transparency, accountability, and also having integrity. Like I said, it is the duty of government to protect the Zambian people. Right now, if so there are some people who have rushed towards some COVID vaccines and have had some bad outcomes where a country may probably imports a lot of COVID vaccines in a rushed manner probably, and then you only find that it's not effective against the variants that you have. And that is why I've said, while we are following the cabinet route, the cabinet memo, we're also being informed by science, genomic sequencing that we keep on talking about every day, to look at which variants are most prevalent of the coronavirus in Zambia, and which coronavirus vaccine are we going to recommend. And I can tell you that we've done a lot of work in that area, not only the Minister of Health alone, but with a lot of cooperating partners. So I just urge you to be a bit patient. Cabinet has not met since we submitted the CAB memo, and we'll be informed very soon when the next cabinet meeting will be, and we're hopeful that will be one of the agendas. So there's been no change in policy except that cabinet has to give approval so that it's authenticated. We didn't want to bring a backward vaccine. You can bring in a vaccine even by tomorrow to Zambia. Then so what? The questions were about integrity. We can't believe this is and that. So I urge Zambians to trust government, to trust the Minister of Health in the process that we're taking. Once cabinet does its duty, we shall be directed, and the nation will be updated. And there will be nothing to hide about the COVID vaccine. I'm sure those of you following international news, you can see it's a topical news all over the country. There are countries, developed countries, who overstock, they overbought a lot of these COVID vaccines. They are now talking about donating a number of them to developing countries. We know, for example, the US government, under the new President Biden, is actually making a huge donation to the COVAX mechanism, $4 billion by the US alone. But what I would urge is that let's trust government, let's allow cabinet to do its job, which will be done very soon, and the nation will be updated. Otherwise, there's been no change in policy, like there will be no COVID vaccine. Then on the other issue, I think on Eastern Province, the schools, Professor Mlenga, you can come in.
Thank you so much, Honorable Minister. Thank you so much, Honorable Minister. Indeed, we continue doing the surveillance in schools so that we can establish the baseline where the cases are from the time that the schools opened. And again, it's a select number of facilities or schools that this surveillance is going on. And also at certain intervals, the tests have to be conducted so that we can see this transmission going on. Again, as pointed out earlier, it's very key to note that if you see infections in a school, they may not be necessarily the transmissions happening within the schools. Some may not be boarding, some have other people coming from outside, and since we have widespread community transmissions, those can also go into schools. Then also teachers can be infected from the community, and the analysis which is associated with this is very critical, so that we don't attribute any infections really to purely because of the schools being opened. Yes, Eastern Province has recorded a number of cases in the schools. The only thing is, in the last 24 hours, we only have Lusaka Secondary School with 10 cases, and also in Central Province as well, Chengelo, there are 2 cases. All are stable, and of course it does include Victoria. It does include the teacher as well. And none of these have been admitted, and none of them is in any critical condition. Thank you, Honorable Minister.
Yeah, and also just to provide guidance that all data, all information, whether for the general public, for schools, for COVID, has to be reported in a more systematic manner through the Zambia National Public Health Institute for all schools, because we have so many schools in Zambia. You can have maybe up to 1,000 schools. Then you can talk about this 1 school and 2 schools and 3 schools. So I think ZNHPI, that is a call to duty for the Zambia National Public Health Institute, working with our provincial and district directors of health, to have 1 report on schools instead of these are sampled cases. So I think from now on, that will be what the policy will be. That way we shall serve the nation better, because we are looking at the whole country, all the 10 provinces, all the schools. So the same way that we are reporting COVID cases for the whole country in that coordinated manner is what we have to do with the school surveillance system, so that the nation can be updated rather than getting information in bits and pieces. Yeah. Then on the MTN donation, I don't know the question. MTN, like I've said, MTN is a group of companies. We know that it's one of the, probably the biggest cell phone company, a mobile company in Africa. MTN has donated $25 million to the African Union, not to Zambia, to the African Union. But Zambia is, as you know, we're part of the African Union, so we're a beneficiary of the African Union vaccine mechanism. Just like also, a candidate on the COVAX mechanism. So that $25 million is part of the African Union, and we know that the African Union has committed a number of vaccines, probably over 4 million, 5 million doses for a country like Zambia. The details will be given, of course, after Cabinet has done its due duty. There's no question about taking money back to African Union, because the money is not in Zambia, it's in Addis Ababa, at the African Union headquarters. That is money, I think, for the whole of Africa, and that probably just increases the number of doses that African countries will get, but you'll be given the details as they unfold. Then there was a question, is it for Professor Mling about UTH, is it the post-COVID-19 clinic, how it's doing? You can tell us.
I think again, Honorable Minister, this clinic we have seen, it's become very busy of late. So right now, we have a number of patients. Today we're expecting close to 40. And on Thursdays, that's when we're doing also the evaluation for their heart as well. As you know, COVID has a number of complications, not just related to the lungs. So we assess all those functions for the organs that may be affected. In terms of the outcomes, as you know, a number of these patients, they still complain of various problems. Largely, they complain of shortness of breath and also general fatigue. We can say that as of this wave, we haven't lost anyone in the post-COVID clinics. But the clinics, they do continue, and we continue seeing also great numbers of people reporting to UTH for the post-COVID clinic. Thank you, Honorable Minister.
Yeah, and just to add, this is a message that I gave when I was touring the health facilities today. Kanyama General Hospital and the Chawama, level 1 or level 2 hospital. So those populations, I think as much as possible, the Ministry of Health want to provide services in a decentralized manner to where people are. Because I can give you an example. Chawama has a catchment population of almost 500,000, close to 500,000. And this Kanyama has a catchment population of close to 300,000. And not to talk about, like Mandef constituency and others. These are huge populations. And like we said, we're dealing with a generalized pandemic. The COVID is in the communities. So as much as possible, we want to normalize the management of COVID-19 patients at those facilities where people are coming from. Because if we refer COVID patients to very distant places, one, we don't have all the ambulances in the world. We're talking about thousands of cases here. So as much as possible, the direction from the Ministry of Health will be that patients are managed very close to where they stay. It will be easier in terms of contact tracing, more convenient for the patient, except those who need specialized care, like Professor Mlenga said. If you are post-COVID, you have other complications that may not be handled at a nearby facility. Those are the ones that should be referred to the tertiary hospitals. Otherwise, we may end up overwhelming the tertiary hospitals. And there are also other services running apart from COVID. We have the usual cases, infectious diseases, TB, HIV, malaria. We have the non-communicable diseases, cardiovascular diseases, diabetes, hypertension, and all these others. Then you talk about the maternal and child health issues. So we'll be updated going forward, but I think, like we said, under the community management strategy for government, for the Ministry of Health, a lot of services have to be pushed where the people are. That way, I think people will uptake these services better than when we refer them to very distant places. Otherwise, they will not comply, they will not go. So that is the approach. So thank you so much. Are there any additional questions?
Good afternoon, Malikana from Spring TV. My question is for Dr. Shivemba. Are test kits stocked up on a daily basis in various clinics and hospitals? Recently, some members of the public have raised concerns that they go to these health facilities and they are normally told that these test kits have run out. Thank you.
Do we have some more questions?
So Dr. Shivemba is the head of laboratory services, so you can respond to that.
Thank you, Honorable Minister, and thank you for that question. So I'll reiterate again. We have got a criteria we use when we are using the antigen test kits. It's not everyone, it's not used on everyone. So if this criteria is not followed, people are reporting that the test kits are stocked up. We just received a consignment which we are distributing now into the provinces. So we are catered for the provinces with the rapid test kits. So again, let's follow the guidelines, and we are going to cater for each and every individual that needs to be tested using test kits. Thank you, Honorable Minister.
Thank you.
Honorable Minister, there are no more questions. I think you may now conclude.
Yeah. So as we conclude, I think the messages are the same. Adherence to the public health guidelines that we've given. We've been announcing over and over that the government through the Ministry of Health is using a multi-sectoral approach. The fight against COVID has to be individualized. You have to take it personal. It will not be done by the next person. It has to be done by you. So wherever we are found as Zambians, if we see someone not wearing a mask or wearing it in a wrong way, on the chin, on the neck, holding it by the hand, let's take full responsibility. By urging such a one, let's remind them, please, can you protect yourself and protect others? So it is our job to make sure that the people that we are living with, the people that we are staying with, the people that we work with, the people that we sell within the markets, people we meet in the shopping malls, in the health facilities, bus stations, including people on minibuses, conductors, drivers, passengers. Let's take it personally to make sure that people are adherent to these measures. Otherwise, if we're not adherent to simple public health guidelines that are announced every day, we may actually have another huge resurgence. We cannot rule out another resurgence if we are not compliant to these very basic, public health guidelines to prevent further community spread of the coronavirus. So those few words, thank you so much, and God richly bless you. Thank you.